tissues, we're going to talk about membranes. So membrane is a thin layer of cells made up of one or two types of tissue that covers the outside of the body or the organs. It can also line they do also line the inside of joints and cavities. There are two main types of membranes, depending on which type of tissue the membrane is composed of. Epithelial membranes are made of epithelial tissue. Keep in mind, epithelial tissue needs connective tissue underneath, so the epithelial membranes are made of epithelial and connective tissue. The connective membrane is just made of connective tissue. There are three types of epithelial membranes: the mucous membranes, the serous membranes, and the cutaneous membrane. There's only one type of connective membrane, and that is the synovial membrane. So the first one we'll talk about is the cutaneous membrane. This is simply the skin. The skin is made up of epithelium with underlying connective tissue, and therefore it's an epithelial membrane. It covers the outside of our body and is used to keep the things on the outside outside and the things inside inside. Next, we have the synovial membrane. The synovial membrane is inside the body and it lines joints. We'll talk about synovial membranes more when we talk about the skeletal system, but for now we should know that a joint is where two bones come together. When two bones come together, they're surrounded in a thick capsule. The inside of that capsule is lined with a synovial membrane that secretes synovial fluid in order to lubricate the joint. Next, we have mucous membranes. There's a specific type of cell called a goblet cell whose job is to secrete mucus. This mucus can have multiple purposes, including trapping foreign particles or lubricating the area, the cavity or the tube, in order to reduce friction. Mucous membranes are going to line cavities and tubes that open up to the outside of the body. So they're within the body, but they open to the outside world. Some examples of where mucous membranes are located are our oral and nasal cavities, so our mouth and our nose, our digestive tract, which helps food glide along more smoothly, the respiratory system, where the mucous membrane traps foreign particles, and the reproductive system. Lastly, we have serous membranes. Serous membranes line body cavities that lack openings to the outside. So our skin was on the outside and stays on the outside. The mucous membrane is for areas, body cavities, tubes, tunnels, that are inside the body but open up to the outside world. Serous membranes are for cavities that are only internal, so they don't have any openings to the outside. Serous membranes are a little bit more complex, not a lot, just a little, in that there are two layers with fluid in the middle. This fluid is thin and watery, and its purpose is to prevent friction in areas that move a lot. So when we look at some of the locations of the serous membranes at the bottom of this slide, you'll see that the pleural membrane surrounds the lungs. The lungs expand when they're filled with air, and then they go back to their resting size when they're not filled with air. We have the pericardial membrane, which is the serous membrane that surrounds the heart. The fluid in between the two layers reduces friction when the heart is beating. And the peritoneal membrane lines the abdominopelvic cavity. This is really helpful for things like digestion, where the intestines are sliding past another part of the intestines as it digests food, and so again, this reduces friction. So these are the three locations of our serous membrane. We have a pleural membrane around our lungs, a pericardial membrane around the heart, and the peritoneal membrane within the abdominopelvic cavity. Keep in mind, there are two layers of the serous membrane. So these two layers each have a name. The visceral membrane is the deeper layer. It's the more internal layer, and it's going to cover the organ itself. The parietal membrane is more superficial, and it's attached to the cavity wall or to whatever fibrous tissue is holding that organ in place. So in this example of the heart, you can see here, right along the heart muscle, you have the visceral pericardium. And on the outside here, which attaches to the wall to hold your heart in place, you have the parietal pericardium. If we look at a completed coloring sheet, you can see this first example here. Then you also have the pleural membrane and the peritoneal membrane. The visceral layer in all three of these examples is colored in pink, and the parietal layer is colored in green. So the visceral layer closely surrounds the organ. It's deeper. And the parietal layer is within the, it lines the body cavity or lines the walls, and it is more superficial. So you can see that in each of the three examples. You could also, I did not color it just to keep everything separate for now, but with the heart being here, you could also color right in close would be the visceral layer, and then you could go and color in the parietal layer as well on that picture. So that is an overview of the 4 types of membranes.